IPL Skin Rejuvenation clinical operation, developed on the basis of laser technology. Intense pulsed light rejuvenation technology makes the light reach the skin in depth and change skin tissues partly in the theory of selective photothermolysis, thus treating and improving skin conditions. It can not only treat pigments, sunburns, allergic tears, rosacea, acne, but also diminish appearance of pores, reduce fine lines, and improve skin radiance and smooth. Contract to those made by chemical substances or lasers that may have the side effect of infection, pigmentation, hypertrophic scars, or herpes simplex. Rejuvenation made by intense pulsed light is safe, reliable, and brand new technology with little injuries. In the late 1990s, intense pulsed light rejuvenation technology is introduced by an Israeli company named ESC. It was promoted in its nation, our country, in 1998, and then was applied worldwide since 2000. It gained a lot of attention by many practitioners and was developed to become one of the major programs in many cosmetic agencies and institutes. Principle of intense pulsed light rejuvenation. Concept of intense pulsed light. The wavelength of intense pulsed light ranges from 400 millimeters to 1200 millimeters. It shows as color spectrum or infrared visible light. The energy of intense pulsed light could focus on targeted tissue like pigments, melanin, wrinkles, or telangiectasia tears with few normal tissue injury surroundings. For example, if the targets are pigments, intense pulsed light could destroy the melanin tissues in order to lighten or diminish pigments. If the targets are telangiectasia tears, intense pulsed light could be absorbed by the telangiectasia tears in order to destroy them, diminish or improve facial telangiectasia tears. Telangiectasia tears is caused because the skin is becoming thinner and thinner and the capillary and vein reviews. The specified wavelength of intense pulsed light can be absorbed well by capillaries in some time, and help coagulate small vasculars without skin injuries. It also stimulates collagen to increase epidermal thickness and density, to prevent vein reviews and improve skin conditions. Treat facial acne and diminish acne spots. Due to excess secretion of sebum, blocked pores causes overgrowth of Propionibacterium acnes and chronic inflammation of the sebaceous follicles, which forms acne. As an anaerobic bacteria, Propionibacterium can be restrained or killed when contact with oxygen when pores enlarged by photothermolysis, which has no effect to the tissue around and help subside inflammation. Intense pulsed light can also lighten the skin and diminish acne spots when treating facial acne. Make skin smooth and diminish fine lines. There are two reasons cause the skin rough. One is excess secretion of sebum, which can be found for people in their adolescence, and the other is excess sun exposure or bad environment, which can be found for those working outside the office. Operation of intense pulsed light rejuvenation. 1. Preparing for treatment. The operator should clean his hands. Wear a mask and suitable protective eyewear to protect his eyes. The operator should prepare disinfected bed sheet, cool gel, disinfected cotton ball and towel and water with the eyes for skin code when necessary. Prepare protective eyewear and wet towels for protection of the patient's eyes, and apply ointment when hurts or burns occur. 2. Treatment procedure. 1. Let the patient lie on the treatment bed and clean his face thoroughly. 2. Let the patient wear protective eyewear and a wet towel. 3. The operator should wear protective eyewear for eye protection. 4. The operator should describe the procedures to the patient to make him relax. Apply a piece of coolant of 3 mm width and 5 square centimeters area onto the treatment area. Vascular diseases should be applied with normal cool gel, while others should be refrigerated cool gel. Select suitable parameters. This is the key point when treating by intense pulsed light. Generally, operator should start from small parameter, e.g., 2/3 of normal parameters. The parameters include fluence, pulse width, pulse invertal, and pulse distribution. Operator should observe the patient's reaction to different degrees of heat and sting as reference. There are some suggestions below. 1. If the skin is thick and the pigments are deep, the operator could increase the pulse width and fluence. 2. If the skin is thick, darker colored, and the pigments are deeper, the operator could increase the pulse interval. 3. If the skin is thin, sensitive, and darker colored, the operator could decrease the fluence. 4. Decrease the fluence when treating the area with less subcutaneous tissue. 5. Increase the fluence gradually according to the times of treatments. 6. Increase the fluence when there is little effect and the pain is accepted by patient. General parameters suggested below. 1. Hair removal. Fluence 8 to 18 joules square centimeters. Pulse width 4 to 6 milliseconds. Pulse interval 15 to 30 milliseconds. Skin rejuvenation. Fluence 10 to 20 joules square centimeters. Pulse width 5 to 6 milliseconds. Pulse interval 15 to 20 milliseconds. Three. Red blood streak. Fluence 12 to 25 joules square centimeters. Pulse width 4 to 6 milliseconds. Pulse interval 10 to 30 milliseconds. 4. CNE. Fluence 8 to 18 joules square centimeters. Pulse width 4 to 5 milliseconds. Pulse interval 15 to 30 milliseconds. On the handpiece on the skin, and press a button to emit intense pulsed light onto the skin. Be sure to keep 2 mm between skin and the handpiece. According to the patient's duration and reaction, the operator could change the fluence and the distance between skin and handpiece. Please be sure to let the treatment area could absorb enough energy with no injuries to the epidermis. adjust the treatment parameters according to different reactions and effects of different patients. Every spot should be overlapped 1 mm. Notice 1. After opening the system, the operator and the system personnel in room should wear protective eyewear. 2. Do not let the treatment head into other areas even if there is no energy. 3. There is a possibility of scars when there is large energy of improper parameter. 4. Apply bore ointment when burns occur and drainage when blisters occur. Inform patients of preventing the treatment area from infection and sun exposure in 1 month. 5. Take a treatment record for reference and better treatment in future. Pregnancy. The diabetic and those has a history of some allergies, keloid scar tissue, peeling treatment, or psychological problems to be excluded from the treatment. The operators should discuss with the patient about his expectations to the treatment in terms of defining success criteria for the treatment and avoid any unrealistic expectations.